Okay, so Grace, this is our fundraiser for the care, for the home care that you're receiving. So we're just going to go through your diabetes, how we've even saved your eyesight, people can see already, how we've changed your health, even helped reverse your dementia a little bit. And then we're going to go through quickly why you're entitled to assisted living and family managed home care, and we're going to show the documents. Before that, we're going to show the policies and procedures for looking after somebody like you, and the time as printed out by the doctor for the tax credit that the CRA recognizes. And at the very end, I'm going to show my angiogram where I should be dead, and I'm going to show the response from the doctor a year later and how I use herbs. So let's just very quickly go through here if we can, so we don't take up too much of people's time.
Yes.
You find that the care, before we start, you find the care has been good?
Yes.
Yes, you're happy basically, right? It's not easy, but you're happy, right?
Because good results, of course, I will be pleased.
Good results. That's what we go by. We don't go qualitatively, we go by quantitatively, right?
Yes.
So let's go. So we can see here that Grace had now it's mild non-proliferative diabetic retinopathy. I didn't know Grace was even going blind when I met her, but she was. And then this here, what I want you to understand is that this here was to a memory clinic at the hospital, and it says she forgets to pay bills, needs reminders from the phone for appointments. It also says down here forgetting her blood sugar right after taking her reading, which is very, very important, and leaving the taps and stove on a few times. But most importantly, you can't remember even when you took your medicine, right? Even 5 minutes later with me now. Everything is perfect for you except that little very short-term memory. And that's not a big deal when you're as effervescent as you are, Grace. So here, just so that you know, some of the best information we got, sugar should be between 6 and 10 before meals and 2 hours after between 8 and 12. So we know from our learning so far that you shouldn't go above 12. That's when you have damage.
Okay.
So we do our very, very best to stay below 12. We have a new term we're using called hyperglycemic dementia. They call it diabetes type 3, and it's reversible, Grace. So then if we look here, this is the disability tax credit certificate, and it's for life-sustaining therapy, insulin therapy by injection, okay?
Yes.
This is why when I found you near the end of COVID, or with a year left, you were in really, really bad shape because you didn't have anybody helping you. And since then, it's changed completely. So for your life-sustaining therapy, Part 1 is 17 and a half hours and Part 2 is 13 and a half hours. People can slow down and read a little more if they want, but I just want to quickly go through so I don't waste their time. And then if they want to slow down, they can. If they want to watch some of our other movies regarding who we are, like the fact that you brought the Libra to Canada in the first place, or that you're a fraud examiner, or different things about us they might want to know. And Part 1 is management of glucose within target range. This is how many times a day, 10 minutes, 40 minutes, 7 days. There's your hours. Okay, you can look at that yourselves and figure that out. But it does give a total of 31 hours. And then if we come back to here, so Grace is 31 hours for insulin treatment. And if we come back to here, this is the government saying that she's eligible for future years, and it says down here a claim can be made for either these medical expenses or the disability about whichever is more beneficial. So that means there that you can claim the person who looks after you, or as a percentage. We tried to fix that. We're waiting for the results to come back now. And this is from your doctor. which we try to keep most of the information out if we can. Oh, this is to accompany our application for the family managed home care. It says you have some cognitive impairment. It says that you have a coach, that's me, Mark Hayden. It says I've been counseling you around proper nutrition, helping with meal prep, monitoring and supporting proper medication and timing and dosing, providing emotional and physical support. And since our partnership, your hemoglobin A1C has been under better control and you're generally very well supported. Mark visits and calls Grace multiple times a day, available for scheduled, unscheduled, and urgent visits. Grace has been paying Mark a small stipend. So you were giving me a little bit periodically, but not like $50 a day basically by the time money went back to you. So at least it helped me with my gas and stuff, right? It says we declined traditional home care, but we didn't. It's just that they can't meet your needs, and we're going to show that, okay? And we're going to start to show it right here with assisted living. Assisted living services support people who need a greater level of service than what home care can offer, but without the medical monitoring or 24/7 nursing supervision provided in long-term care homes. With all your little appointments, 10 minutes, 10 minutes, 10 minutes and everything, they can't possibly look after you because they can't make it for you. And we're going to go on and explain why. These services are most often, but not only, provided in settings such as supportive housing or apartment buildings where clients live close together. So somebody, say a lady in this building with a couple of children, could have a job at home looking after you or two people, and it's the same person always looking after you, the same person responsible for you. So it adds a level of responsibility to the care that is lacking these days. It creates employment at the local level, and you have continuity in your care. If you have the same person looking after you 24/7, they can become accustomed to your metabolism and your needs and your activities, and they can know what to feed you, when to feed you, how to help you, right? Which is basically what I do. And this is what you asked me. So this enables care to be provided as a drop-in or as-needed basis instead of scheduled visits, which is what your doctor wrote. There were times in the beginning when your glucose alarm would go off at 5 o'clock in the morning. I would come over here, right? But I didn't really understand that your body starts to wake up an hour and a half before you. That's a normal condition, which we will explain to people at another time. It's very, very important to make sure your glucose level doesn't get too high in the morning or you're struggling all day. So these services are targeted towards high-risk seniors. And services include personal support services 24 hours a day, 7 days a week, scheduled and non-scheduled. Home care cannot give you non-scheduled visits. They cannot look after your needs, right? So we know that. And as a matter of fact, we have a letter from them and people will see where they say they can't look after you. So then this is family managed home care. Who is eligible? Patients in extraordinary circumstances. Who are patients in extraordinary unique scheduling issues. Home care can look after you. You need family managed care. They won't give it to you. They won't help us at all. And you want to stay in your condo, and well, you should. And who can the patient or substitute decision maker hire? 18 years of age. It can be an individual, Grace. It can be an independent contractor or an agency. It doesn't just have to be an agency, which is what they're trying to do to us. But even then, you can't have the unscheduled visits. It does not work. So you got to be 18 years of age, and then here, be in good standing with your regulatory college in case it's a professional service, right? But if it's an individual independent contractor, you don't need that. But you do need to have some liability, and you do need to have a CPR certificate, and you do need to be capable, which obviously I'm capable. We're going to probably put a course together. That's what we're going to do actually for people to help look after others, and pass the vulnerable sector check. I've been coaching kids for 25 years. I pass that every year, every second year for many, many years. And then, here it is. Here's the answer from home care. We do not have policies and procedures specifically for seniors with memory issues and insulin requirements. They do not. They cannot look after you when they finally, almost 2 years later, acknowledge it. We have many other letters similar to, but finally they came right out. And we also have other letters from your doctor saying what a great job we're doing. So we didn't put everything here because we don't want this video to be too long. And I just wanted to show, you were in the hospital recently. This is your discharge summary. I don't want to show too many things, but right here they're showing you with type 2 diabetes now, but it's not type 2, it's got the M after it. It means they don't even think you need insulin anymore. We've reduced your insulin and got you so healthy, they don't even think you need insulin anymore. And they want to raise your glucose up a little bit because they think, anyway, we have a little slightly difference of opinion, but we've worked it out and we're on the same page now. But they actually said you do not need insulin anymore. So that's how great we've done with the diabetes, Grace. That's how great we've done. And you can walk, you walked 6 or 7 kilometers when we did the walk with Israel. You walked for 3.5 hours the other day when we went out to the jazz festival down in the beaches. And now I just want to show people, this is my heart. When we met and Grace asked me to help her, initially I knew I was dying, but nobody else did, but I did because I could feel it right in my heart. You can see that I'm 100% blocked here. You can see that I'm 80% blocked and 70% blocked. So I was in pretty bad shape, even though most people didn't know. But I tried to get Grace assisted living, which is what I just showed everybody, right, Grace? And this is what, right? You asked me to help you with your insulin. You asked me to help you with the home care and the diabetes care because you said you thought there were issues with both of them. And you are a fraud examiner, and it looks like you were right. I didn't expect to be alive long enough to figure it out. I was only trying to get you assisted living in the beginning because I was supposed to die. And then as the project wore on, I learned more and more. You became better and better. I became better and better. And now I'm out of my savings. You need help. We need to continue the project. So we're going to write a book about our experience, how we did what we did, and put together a little course for people. Even though we're not medical doctors, and they should talk to their own doctors, you know, medical disclaimer, I'm not responsible. They have to do this under their own and with the advice of their medical team, but they can see what we did, right?
We are sharing our successful experiences.
Yes. So here it says, never mind all my medical problem, but oh yeah, they wanted to do surgical revascularization for coronary artery disease. They wanted to do heart bypass, and they're saying I had symptomatic 3-vessel coronary artery disease. That means they wanted to do triple heart bypass surgery on me last year, Grace. Last June 20th, they did my, here it is here, June 20th, 22. That's when they did my angiogram and I was trying to find you help. That's over a year ago. And I couldn't get you help or anything, and I survived and all that. And now this is the letter from the Heart Health Institute. Oh, Dr. Evanasi's name is there. And this is about me, and it says that blood pressure acceptable, continue to use marijuana, and cholesterol status is being treated with herbal therapies. Herbal therapies for my cholesterol, no statins. And the marijuana is actually because I have a birth challenge that will kill most people with pain. So I use marijuana instead of opiates, and I've been alive for 30 years coaching hockey and soccer. So you've done really, really, really well, Grace. Come over here and sit down for a second with me, please. So we've done very, very well. And you told me in the beginning you wanted me to help you with, you said there was a problem with diabetes care, the food and everything. You didn't want to eat. You sold me so many problems. And you told me you thought there was a problem with home care. And most importantly, you told me that you were willing to be alive as long as you were contributing to society.
Yes, that's my goal.
And we decided that we should be able to help possibly hundreds of millions of people, even with, now we know of hyperglycemic dementia, which can be reversed. We're pretty sure that they shouldn't be diagnosing it at 6 mmol. They should be, there's no damage till 12, so why fix it if it isn't broke, right? So we've got lots of videos of you eating, videos of us walking, everything. What would you like to add at this point?
I like to give some hope and encouragement to those people wanted to be treated from diabetic. I have the story of my attempts are very truthful and useful for patients like me.
Yes, Grace. You're not in a nursing home.
Hope.
You're strong. Your executive functioning skills are excellent. You need help. She needs help. She has memory problems short term. So taking medications, paying bills, all that type of stuff is a bit difficult. And go ahead, Grace.
Your treatments, the specialty about your treatments for me, you do not add on medicines for me. You use, the right measures to treat the problem. Instead of intensify the situation, you make it simpler for me, make my life much happier.
That's good. You also asked me to reduce your medications, and you showed me a doctor's note from when they did some studies on you that said you were taking too many medications. So we have reduced your meds.
We have records.
Yeah, we're doing great. So anyway, help us, help Grace, help us finish the book and the course, and then you can all help yourselves. It's a great day, Grace.
Make the world a different, improved situation.
Let's save money for healthcare. Let's improve healthcare, and let's make the workload less for the doctors and the nurses.
And healthier people.
God bless everybody. Thank you very much.
Thank you.